All right, good morning, everyone. So this morning, I'm going to wait for a couple people to get here, but this morning we are going to be talking about recurrent BPPVs. That's benign paroxysmal positional vertigo. And remember, none of this is medical advice. This doesn't necessarily apply to you. I am not giving you medical advice. I am probably not your physical therapist. And even if I am your physical therapist, it's not a good idea to take general advice, and I will give you specific advice if you are my patient. So again, not medical advice, regardless of whether or not you are my patient. Okay, so good morning, everyone. We're going to be talking about recurrent BPPV, why it happens, how to maybe avoid it, things that are triggers, and all that. You guys can feel free to ask questions in the comments, and I'll try to get to as many as I can, but there tends to be quite a few, and you know how timing goes. So we'll get started. So BPPV, let's start with just defining it. So it is benign paroxysmal positional vertigo. That means benign. It means it's not going to be a cause of death. It can lead to an increased risk of falls, but it is benign. Paroxysmal, it means it's spontaneous and it comes and goes really quickly and kind of out of nowhere. Positional, meaning that when you change positions, that's when you're going to get the symptoms, and vertigo, meaning not just lightheadedness or dizziness, but truly the incorrect perception that you or the room is spinning. So remember the other day we talked about how dizziness and vertigo are not the same. Vertigo has a very specific definition, meaning it's the incorrect perception that you or the room are moving, and that's very specific for BPPV especially. So when we have BPPV, 80% of the time-ish, don't take that exact statistic, but approximately 80% of the time, we don't know why it happens. And when someone comes into the clinic and they have just BPPV and nothing else, they've never been dizzy before, they've never really had a migraine before, they've never had anything else vestibular seeming, we call that a unicorn. You treat the BPPV, they leave, you never see them again. Great. Those are not the kind of people we're talking about today. The kind of people we're talking about today are the kind of people that get recurrent BPPV. This can happen for a lot of reasons. One of the reasons that you can get recurrent BPPV is from an underlying vestibular condition. And I know that's why a lot of people are here listening to this and on my page in general, is because you may have a recurrent BPPV issue. One of the reasons that you can have recurrent BPPV, or a couple of the reasons, are Meniere's disease, vestibular neuritis, whether that's acute or like the symptoms went away, but you always have a weakness on that side, and vestibular migraine, Meniere's disease, neuritis. Those are the big three that I see. The other things that you can see are low vitamin D, high blood pressure, osteoporosis, general aging. If you go through chemotherapy, those are the big ones that I see with people having recurrent BPPV. So if you have a vestibular condition, it's usually from a pressure the recurrent BPPV comes from a pressure fluctuation in your inner ear or a weakness in that side. So a pressure fluctuation, like within Meniere's disease, when you have endolymph and there is a pressure increase because there's a volume increase in fluid in your inner ear when you're having a Meniere's attack, that can cause the crystals in your inner ear that we all know are there to slip out into that posterior or horizontal canal. When that happens, that's when you get BPPV. It's not something that I would recommend trying to treat yourself, because if you try and treat it yourself, I more frequently than not find that people end up making it worse because of the exact positioning of the Epley maneuver not being correct. Additionally, if you try and treat it yourself, you might just treat the wrong canal. If you are going to treat it yourself, I really recommend that it not be the first time you've had it, and that you've gone to a specialist, whether that's a PT or an ENT, a neurootologist previously. They might teach you how to do an Epley maneuver or how to do a 270 barbecue roll so that you're not doing it just on your own from the get-go. The requirements in my clinic that I have for people to have do an epley maneuver or a roll maneuver independently are that you have to bring the pillow that you're going to use when you do the maneuver. You have to bring another person, and you have to be able to exactly explain and show me without me saying anything or touching any part of your head to help you at all. You need to be able to do that entirely independently 3 or 4 times perfectly before I say, yeah, it's safe for you to do this at home, on vacation, what have you. So let's go back to the other reasons you can have BPPV. Another reason is vestibular migraine. And I once saw a statistic that said if you have BPPV once, there's like a 25% chance that you also have a migraine component. This might not be evident to you at the moment, but people with BPPV do tend to also have migraine, especially vestibular migraine. That's because if there is a weakness or something going on with that nerve, it can cause some sort of fluctuation in your ear, and that can cause the recurrent BPPV. So avoiding BPPV recurring can kind of be a difficult line to walk, because you want, of course, to prevent all of your symptoms, flare-ups, attacks, but sometimes it just seems impossible to prevent the BPPV. But I think what I have found anecdotally with my patients is that the more you can control the underlying condition, the less frequently you'll have BPPV. BPPV can be really scary and debilitating, but after you know what it is, you will know that the symptoms will only come with a big position change. So at the beginning, when we defined BPPV, we talked about the big position change. So it will only happen if you lay down and put your head back like this in whatever canal is dependent, or if you sit back up, if you look into a cabinet, or you might go to the dentist or get your hair done, either washing your hair in the bowl, anything where you put your head in this sort of dependent position for the posterior canal, which is the most common canal where you get BPPV. It's really important that you oh my goodness, I lost my train of thought. It's really important when you do that to know that to decrease your anxiety, you can tell yourself, oh, you know what, this isn't going to happen until I change position again. So if you're walking down the street and you have BPPV, the street shouldn't start spinning. You should be able to be safe in the community. So if you treat the underlying condition, just kind of like I go back to all things, treating the underlying condition, you can, you will be able to treat the recurring BPPV. So things that I tend to say will be helpful for that are making sure you have enough vitamin D, exercising in general, so that you don't get osteoporosis, so making sure your bone density stays high, having enough calcium in your body, all those things. We talk a lot about how exercise decreases the number of attacks of vertigo or vestibular, whatever symptom you have in general. So if you decrease the number of attacks, you'll decrease the amount of BPPV recurrences you might have. It will also help decrease your blood pressure overall, and we know that having high blood pressure can be a problem in BPPV. If you have had or gone through chemotherapy at any point in your life, it can make the place where the ear crystals stay, the otoconia, where they sit in your inner ear, it can make them more likely to fall off. So if you are that person, you might just be prone to BPPV, and you might be the kind of person who it will be a good idea for you to go to the doctor and ask them to teach you how to do an epley maneuver if this is really happening so frequently, so that you can do it safely at home. So things that won't help treat BPPV are normal head movements. So if you have BPPV and you're trying to treat it and you're like, oh, I'm going to do a bunch of VOR exercises, that can be helpful to help train your vestibular system to be stronger, but it won't help treat the BPPV itself. So if you have a different kind of dizziness, like gaze instability, just like an Epley maneuver, which is made for BPPV, won't help treat that, the gaze stability exercises won't help treat the BPPV. If you have some BPPV that just won't go away, sometimes habituation exercises like VOR times 1, VOR cancellation, all those exercises we talk about can help adapt your system to a new normal, but they won't have the actual crystals go back into place. The most common form of BPPV is posterior canal BPPV. And what that means is you have 3 canals. One goes up like this. One is on the, so it's the anterior. The other one is on the side here and it's horizontal. And the last one's posterior and it's back here. Those 3 canals are the only places where if you get your otoconia in there, then it will cause BPPV. So if you have it in the posterior, it will cause the torsional kind of nystagmus in your eyes, and that's what we're looking for when we're treating it. So if you have posterior canal, it will be torsional, upbeating towards the down part, towards the undermost ear. If you have horizontal, it can be either geotropic or ageotropic in the roll test position. And if you have anterior canal BPPV, which is super, super, super abnormal, it will be just this way. So it's important to be able to distinguish those different kinds because it can be stuck in different parts of your semicircular canals. It can be stuck in the back part or the front part. And it's important that you know which kind because the maneuver changes. An Epley maneuver will not treat every single kind of BPPV. Sometimes you need a Guffoni maneuver, a Kim maneuver. There are so many different kinds, and it's really important that that you determine exactly what kind of nystagmus or involuntary eye movement that you're having in order to use the correct form of a maneuver. Someone asking, I had all the testing at City Hospital. They didn't see BPPV. My VT definitely says I have it. So you can have positional vertigo without having BPPV. So you might feel symptoms in that plane if you're in a Dix-Hallpike position, let's say, for posterior canal BPPV. You might have symptoms and be like, oh, I feel really lightheaded. That's definitely a thing. Happens all the time. It can be from blood pressure. It can be if you have a vascular problem in your neck. It can be from a lot of different issues. You might even have nystagmus that isn't the correct kind of nystagmus, and that's why it's so important to get a vestibular therapist who knows exactly what kind of nystagmus to look for. Because if you have nystagmus and you're in a certain position, but your nystagmus doesn't look right for what it should in that position, then you might have a different neurological problem. This happens a lot in people with MS and a lot in people that have vestibular migraine. So you can get what looks like BPPV, but isn't truly BPPV. It won't hurt to try and treat it. So if you and your vestibular therapist are like, hey, I think you actually might have posterior canal BPPV, even though it didn't look like it on the test, let's just try 2 or 3 maneuvers because it won't hurt. It won't knock anything out of place. It will only work to help you. It can't hurt anything in this case. So if you want to try and see if an Epley maneuver helps, it should help within 1 to 3 sessions. This is like the best kind of vertigo to have, a lot of people say, because although it is terrifying, it really does go away quickly. The Epley maneuvers are incredibly effective. So if you think, or your VT thinks, hey, yeah, you have BPPV, do a couple Epley maneuvers with your provider, or do a couple roll tests and 270 roll treatments in order to treat the BPPV, but I would not recommend that you just keep treating it forever, because if you have recurrent BPPV and you just keep treating it and it keeps not going away, that's not going to be helpful for you and you're missing a different or underlying condition. What other questions do you guys have? If you have no other questions, you had therapy in a chair while it was moving lines and circles. Sometimes also put goggles on me. It felt like torture, but it helped. I'm so glad it helped. Yeah. So if you're doing like gaze exercises, these are not for BPPV. This is for other vestibular conditions, and you're like, I have to stop because of financial issues. That I think it's a really good idea to keep doing the exercises on your own, but ask your PT like, hey, how do I progress these? How do I make these harder? How do I make these easier? What should I do in the future to continue to progress through my treatment independently? And they should be able to really help with that. But I do think it's always a good idea to keep doing your exercises. So to kind of recap what helps recurrent BPPV, so treating the underlying condition, whether that is a vestibular migraine or it's Meniere's disease, secondary endolymphatic hydrops, which is a form of Meniere's disease. Sorry, my dog is trying to get on the couch. Which is a form of Meniere's disease. Keeping your vitamin D nice and high and at a stable level will really help, we've found recently. And then working on your blood pressure. That can be through diet, it can be through exercise, it could be through any other way that you can lower your blood pressure will really help. Again, if you want to learn how to do an Epley maneuver, I would recommend finding a vestibular therapist. Don't just go on the internet and do it yourself. There is a good app. It's called Healing Vertigo, where the person who makes it, she's also on Instagram. She has made an app for this. If you want to try and treat it yourself, I would recommend at least using that app or having your vestibular therapist treat it first, and then after they teach you how, as a reminder to have this app to be able to help you get through it in the future. But if you guys don't have any other questions, we will go for today. I'll leave this up here for a minute just in case. I'd always, as always, super happy to answer any questions about BPPV or anything else. She does this one every time I come in. So I can't answer specific medical advice on here, especially for a singular person. But again, like I was saying before, if a Semont or an Epley or Guffoni or Kim maneuver or whatever maneuver you're using, you need it like all of the time and it doesn't make you feel better, it might be a different kind of positional vertigo, probably not BPPV. And you might have an underlying different condition or problem. And if you have the vestibular migraine that you're aware of, that people, so this is not specifically to the person who asked this question, but if you're a person you know you have vestibular migraine and the treatment that you're using for BPPV just isn't working, then you're like, okay, what other things can I use to treat this? Let's use diet, exercise, preventative or acute medications. Vitamins and minerals really help, like B2, magnesium, CoQ10, all those things can help with the underlying part. I'm seeing my doctor today to test me. I've been awfully balanced and woozy lately, but no vertigo. So you will pretty much always feel room-splitting vertigo if it's BPPV, but you can have other kinds of dizziness and wooziness in general if you are feeling dizzy. So I think it is a really good thing to test all of your balance and vestibular system, so you can do it through balance tests like the modified CTSIB, CATSIB, people say it differently, and that basically tests your balance of different functions. So your visual stimulation, your proprioceptive feeling of the floor, and your vestibular system by having you have eyes closed, eyes open, standing on different surfaces. It's also good to test gaze stability, motion sensitivity, all those things. If you are testing all those things, you can get a more whole picture of what could be making you dizzy, because a lot of times it's just diagnosed as BPPV because that's the most common kind of vertigo. It is truly the most common, overarching, most well-known form of vertigo, but it doesn't necessarily mean, that it always is vertigo. I have a very attached dog. So just because you have vertigo and dizziness, and you feel like you're rocking back and forth and moving and all those things, it does not mean you have BPPV, especially if you have other symptoms of imbalance and things like that. It's really important to understand that it's not always BPPV. It's also really important that if you have BPPV, and you've treated it, there's nothing you can do like mechanically, like bending over or laying down or sleeping on one pillow instead of two pillows. There's nothing you really can do that we've found in research at all to make it happen. So you're like, I'm just going to sleep on two pillows for the rest of my life, even though I don't think it's comfortable. It's actually a worse idea than just living your life, and if you get BPPV, to just treat it. Because I think it's really important that everyone should realize that if you do something that's not comfortable when you're thank you, my dog is sweet, thank you. If you do something uncomfortable, you're going to get neck pain, and that can really exacerbate cervicogenic dizziness, cervical issues, other forms of dizziness. Other tests for balance have a specific name. So there's a modified CTSIB, which is, I think there's a video of how to do it on my reels if you scroll all the way down. You can do single leg stance, tandem stance, the dynamic gait index, I usually do the 4-item DGI, which is walking regular, speeding up, slowing down, walking with left and right head turns, walking with up and down head turns. That's a great one. All of those balance tests are great, but the one that I said originally is the modified CAT-SIB or SIT-SIB, however you want to say it. All of these are also on Google if you want to Google the ways to test, and you can bring them to your doctor to help. Do you think that it will get better as I exercise more? So again, I can't give you specific medical advice, but this is generally how we think about exercise with vestibular disorders. Exercise is really great for vestibular disorders because it can help prevent episodes of vertigo, dizziness, etc. It's really important that you do exercise because of that. It's also good for your mental, physical, emotional health. So exercise across the board, great. If exercise makes you dizzy, you might need like a return to insert exercise here program. So you can have a return to run program, return to walk, bike, Peloton, whatever it is, program. If that's the case, and you're like, if I do 30 minutes of Peloton, I get really dizzy. I always tell my patients, if the screen is making you dizzy, just use the audio and put a towel over the screen so that all of the visual stimuli aren't going into your brain at once, because that can be really bothersome for some people. Or you can wear your migraine shields or other kind of migraine blue light glasses that might help you. And then the last thing that I recommend is if it's like 30 minutes, you're like, okay, I kind of start feeling dizzy at like 25-ish minutes, but 30 is too much. Do 25 minutes until 25 minutes doesn't make you super dizzy anymore. And then going 26 minutes, 27, 28, 29, 30. That's what I usually tell my patients. I miss exercising so much, but was told not to go to the gym. I don't know who told you that. If someone told you not to go to the gym, DM me. I have a program for people who are looking to start exercising again. I think it's a really good idea to exercise for all the reasons I mentioned before, especially people with vestibular disorders. The more you move, the better you'll feel. Your vestibular system is like a gyroscope. So if you think about your iPhone or you're like on Google Maps or something, and the little arrow thing that looks like this, like I guess it's an opposite arrow, the cone shaped thing, it's like pointing the wrong way or something. You kind of like shake your phone and it resets. I don't know if you've ever done that, but it works. That is exactly how your vestibular system works, except for it takes longer than just like 1 second to shake your head. It's really important that you move because your vestibular system responds to your normal amount of movement by knowing how you move, why you move. That's why little kids can spin in circles, spin, and like lay down on the grass and the world goes by, but they're like, I don't feel sick, I feel fine. It's because they're used to spinning upside down, going left and right, like running all over the place, zigzagging across the yard. And then as we age, we move less and less, and our vestibular system is used to less stimulation. And so then if you get a vestibular disorder and you're used to less stimulation, that can be problematic, and that is a lot of times why you feel sick. So I recommend move as much as you can in a comfortable, safe way. So planning a gradual return to the gym is a great idea. All right, what other questions do you guys have? Let me scroll up and see if there are any, but please feel free to ask me. All right, you guys, so it looks like there are no more questions unless one comes up right now. But it was so great to talk to you guys. This will be uploaded on IGTV. Remember, none of this is medical advice, whether or not you are my patient. If you need help exercising or you need a vestibular therapist, I am your girl. All right, see you guys later. Bye.